Hello, I'm Valerie White, Interim Director of Public Health at NHS Dumfries and Galloway. I'm sure that everybody who's watching this post will be very aware of the serious situation we have faced in our region in relation to coronavirus over recent weeks. Very sadly, the high infection rates that we have seen over Christmas and the early New Year period are translating into a significant number of individuals needing hospital care who have coronavirus. And in the morning, when I look at the numbers that are in hospital, both in our general wards and also in our critical care unit, my heart absolutely goes out to those individuals and their family and friends at this really difficult time. But our teams are doing an amazing job in treating people who are in hospital and looking after them and doing it with such grace. And we thank our staff so much for that. And our staff right across the Health and Social Care Partnership are working really, really hard to support people at this really difficult of time. And we, as an organisation, are being hugely supported by our other public sector partners in the voluntary sector in working together to tackle coronavirus. So thank you to everybody that is involved and is helping us. And to you, our local communities, thank you so much for everything that you are doing in this fight against coronavirus. We have seen a reduction in the rates of infection over recent days, but they are still far too high, and we need to get these rates of transmission down. And I know that this lockdown situation is incredibly difficult on so many different levels, but we need to stick with it. We need to stay at home except for essential reasons. Interactions that we have with individuals out with our household increases the risk of the virus being passed on, and there is no region or area of Dumfries and Galloway that has not been touched by coronavirus. Even though we are a remote and rural region and we have done so well up to now, we have unfortunately been badly affected by the new variant of coronavirus, which is much more transmissible than the previous one. And so each and every one of us needs to redouble our efforts and follow that stay at home message. Please do be assured though that our health and social care services are still here. We are still able to provide care, and if you need us, please do access the services that you need. But we would ask that you think about the best way to access services, because we are busy, but we are absolutely still here for you all. Please do continue to play your part. If you have any symptoms of coronavirus, please do immediately self-isolate with your household and book a test. We have increased access to testing. We now have a walk-through centre in Dumfries, which is open 7 days a week, and that has meant that we've been able to increase access to mobile testing units across the region, and postal home testing kits are also available as well. So please continue, as you have done over so many weeks and months, to follow these rules and guidance. By reducing the rates of transmission, we will be able to start to move forward slowly out of this lockdown situation, which is so difficult for us all. There is light at the end of the tunnel. Our vaccination programme is rolling out, but vaccinations are not a magic bullet in this situation. Individuals who have been vaccinated will still need to follow all the rules and guidance in relation to social distancing and that stay at home message as well. It will take time before we have enough people vaccinated in our communities to really see the effects of that. So whilst there is hope, just right now, what we have to do is stay home and stay safe and save lives. Thank you.